Well, first of all, I'm a firm believer that whatever happens to us is the work of the universe. I'd like to use that word rather than God. It all started off years ago, more than 30 years ago, when I happened to be introduced to two people through a fellow Rotarian, friend of mine, to two individuals who had set up the Indian Cancer Society in Bangalore, Karnataka chapter. And they talked to me, I gave them some ideas, and then my Rotary Club started sponsoring some of their camps. And during this long process, one of them, Kishore Rao, he had this bee in his bonnet, so to say, of wanting to establish a hospice for cancer patients. So he kept talking to me. And it then so happened, again, I won't say by chance, but the universe designed it, is that the person who became president of my Rotary Club, Gurmeet Randhawa, he kept talking to me that he was keen that our Rotary Club should take on a project, a permanent project involving everybody. And so I thought, why not Indian Cancer Society and Rotary Indiranagar join hands together? And then, we met and we signed the trust deed. So initially, of course, I was, elected, so to say, as a chairman of the trust, and being a practicing surgeon, I felt that what's the point in my hanging around here as a chairman if I don't know what palliative care or palliative medicine is? So again, serendipity, too long a story to tell on film, but I proceeded and did the diploma in palliative medicine from the Cardiff University. Just at the time, I was detected of having kidney failure. And over about 5 years or so, I was very sick. I mean, I'd be well and sick and well and sick. I underwent 3 kidney transplants, major complications of the second transplant, and I had to have bilateral hip replacement and so on and so forth. And by the time my third transplant was over 13 years ago, my nephrologist said, thank you very much. We've bailed you out 3 times. I don't think it's a great idea for you to continue to practice as a surgeon. So I said, what do I do now? And there again, the universe answered. I concentrated on coming to Karnataka, learning a little more. I did the MSc, and I was also invited to become president of the Indian Association of Palliative Care. They tolerated me for 2 terms, also 6 years. And I find that I'm much busier than I was in my profession earlier as a surgeon. And it's enormously satisfying experience. And then, I met people and got into this end-of-life care thing. We're at the national level. We've gone to Supreme Court and done so many other things. So it's been an interesting journey.